Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the relationship between avoidant personality disorder, I'll call this APD, borderline personality disorder, I'll call this BPD, and affective instability? Some other related questions: should affective instability be one of the symptoms for APD? What are the similarities between APD and BPD? And which one is worse? So if you've watched one of my videos before, you know I really can't answer the which one is worse. That's an impossible question to answer. But I do have an anecdote from a group that I observed a while back that offered kind of an interesting perspective on this question. And I'll get to that toward the end of the video. So all these are interesting questions. Many people have commented that they've noticed that individuals who have APD tend to have difficulty controlling emotions. When we think of emotional dysregulation and personality disorders, we typically think of BPD. It's actually one of the symptom criteria for BPD. Now, perhaps we might also think of histrionic, antisocial, and maybe even narcissistic when it comes to emotional dysregulation, which of course would account for all four of the cluster B personality disorders. But typically we would not think of avoidant personality disorder, at least not from the definition of this disorder as it appears in the DSM. When we think of cluster C pathology, that includes, of course, APD, dependent personality disorder, and obsessive compulsive personality disorder, we may think that dependent could have some emotional dysregulation, but not really the other two. Again, typically we would think of cluster B first, maybe sometimes dependent personality disorder. So some interesting information about avoidant and borderline. Obviously they're in different clusters. BPD is in cluster B, that's the dramatic erratic cluster, and avoidant, as I mentioned, is in cluster C, the anxious fearful cluster. But they do have some things in common. They are comparable in terms of the prevalence in the population, so their rate of occurrence in the population, again, is quite similar. Both have a high risk of relapse after treatment. Both tend to have a long course. What that means is they tend to be persistent, so they stay around a while in terms of the symptoms, and technically somebody could meet the symptom criteria for a long period of time. And interestingly, the actual impairment that occurs with these disorders is quite similar in terms of its severity, which is kind of a bit surprising. Many people would think that BPD causes more impairment than APD, but according to the research literature, even though the effects of the disorders are different, the overall impairment is actually fairly similar. So if these disorders are equally common, and they both have severe impairment, why do we hear more about BPD? BPD, I think, is the most studied because it's associated with self-harm, and it causes relational difficulties. Now, to be clear, BPD is, of course, a serious disorder. It's not overstudied, it's just studied more than avoidant. Now, avoidant personality disorder is understudied. We don't see it enough in the research literature, and there are many reasons why this is the case. First, individuals with APD are more likely to avoid treatment. If somebody avoids social situations, it makes sense that they would avoid counseling. Counseling is like a social situation. Second, many people with APD are incorrectly diagnosed as having social anxiety disorder. There's quite a bit of overlap between these disorders. So if people with APD are misdiagnosed, they won't be included in studies on avoidant personality disorder. Third, it does not tend to disrupt relationships in the same way. For example, all of the personality disorders are associated with increased risk of getting divorced, except APD. Fourth, people with APD tend to have fewer relationships, fewer people that might help them be motivated to go to treatment. So we see again a number of reasons why APD is not studied as much as we would like. So what about the similarities between these disorders? Well, if we look at the symptom criteria for BPD, we see frantic efforts to avoid abandonment, an unstable relationship pattern, identity disturbance, which is really like a problem with self-image, impulsivity, suicidal behavior, affective instability, I mentioned that before, of course, a chronic feeling of emptiness, anger, and paranoia. If we look at avoidant personality disorder, I won't go through the 7 symptom criteria here, but I can sum it up as a fear of criticism or rejection that interferes with jobs, intimate relationships, and social situations. And also we see somebody with this disorder tends to view themselves as socially inept and inferior. So if we go to consider the similarities, we really don't see too much alike between these disorders. But both of them do have anxiety about abandonment. It looks a little different, right? With BPD, there's a love-hate cycle. That's the unstable relationship pattern. With APD, it's a fear of intimacy, which is relatively stable throughout the course of the disorder. Now, to some extent, both also share a similar fear, not just anxiety about abandonment, but fear of abandonment. But again, just like the anxiety, the fears are expressed in very different ways. BPD has an active component, right? Frantic efforts to avoid abandonment. APD has a passive component, avoidance. Both disorders are characterized by seeing yourself differently than other people see you, so a lack of insight. And actually all of the personality disorders have a lack of insight component. But specifically with these two, there's a negative self-appraisal. So people see themselves more negatively than they actually should see themselves. A main driver in terms of relationships with BPD is that emptiness. A main driver for APD is fearing rejection, but a driver for both would be low self-esteem. So now moving on to the question about affective instability. Is it common with APD? Yes, it is. APD is characterized by negative emotionality, anxiousness, and interpersonal difficulties, all of which are related to emotional dysregulation. Furthermore, we see that people actually use other people to regulate their emotions. So social interactions impart a benefit in that way, because social interactions signal a return to a baseline state of calm, social safety. People tend to feel safe when they're relating to other people, but people with APD don't feel safe in social situations, so that return to a state of calm doesn't happen. Now, another reason why we see affective instability with APD is that individuals with APD tend to suppress their emotions, which we know leads to higher levels of stress in people who score high on experiential avoidance. Negative emotions can actually be decreased for a short time by using suppression and avoidance, which of course is why we think these tactics are used. They are designed to avoid pain. But the negative emotions will rebound at a later time. And when that rebound occurs, it's actually quite strong. So on one side you have feeling better, escaping from negative emotions. On the other side you have feeling much worse. The negative emotions are powerful. This creates a suppression and rebound effect that is essentially a type of affective instability. But of course it's much different than the affective instability we tend to see with BPD. With BPD we see a lot of the emotional dysregulation centers around strong emotional reactions to stimuli, like a fear of being abandoned and paranoia. Should affective instability be added to APD as a symptom criterion? I don't think so. It's something that a clinician should be on the lookout for, but I really don't see evidence that it should be added to the list of symptom criteria. Perhaps the disorder should be restructured and all of the symptoms should be reconsidered, which makes sense considering the overlap between avoidant and social anxiety disorder. Maybe focus more on the lack of insight with APD or the feelings of low self-worth. But just adding one symptom criterion doesn't really take into account all the variables. More research would need to be done here. In terms of making a solid diagnostic classification, it's rarely as simple as adding a symptom to the symptom criteria list. So now to that question I talked about before, which one is worse? Of course, as I mentioned, I really can't answer that, but I do have a story from a time when I was observing a support group, right? This was a group for individuals with personality disorders. And traditionally, a lot of the people in the group had antisocial personality disorder and borderline personality disorder. But we saw this time when there were a few people in the group who had avoidant personality disorder. And actually, primarily at that time, the group had individuals with BPD and APD, and we didn't really see a lot of other personality disorders represented. So we see this discussion occurred about what they learned about the other personality disorder, right? So if somebody had avoidant personality disorder, what they learned about borderline, and if somebody had borderline, what they learned about avoidant. And the which one is worse question kind of came up among the group members. And this is fairly common in group situations. A lot of times group members kind of compare the disorders that they have to the disorders that other people have, right? So again, we see this quite a bit. So this discussion really wasn't surprising. So we see this point in the discussion where the individuals in the group that had APD said that BPD was worse because of the impulsivity. Now, of course, this is a casual discussion, and what I expected to hear next was some sort of reciprocation, like the individuals with BPD telling the people with APD that APD must be worse, right? This wasn't a technical type of situation, and it wasn't a serious comparison. It was just really kind of empathizing and trying to understand each other, right? But what the individuals with BPD said when they were asked the question, which one is worse, they said, we agree that BPD is worse, right? So the reason they gave was that the romantic partners treated people with borderline badly, right? So it's kind of funny because there was no reciprocation, which would have been expected, but also that they blamed the romantic partners, which kind of demonstrates a lack of insight. And again, we're not talking about everybody here with borderline and everybody with avoidant, just the people in this group, just a small number of people that happen to be in this discussion. So that was an interesting experience. It doesn't really, of course, answer the question in any definitive way. It's just something that I saw that I thought was interesting from my clinical experience. So I know whenever I talk about topics like this, comparing avoidant to borderline and looking at affective instability, there are going to be a lot of different opinions, people who agree with me, disagree with me, and have other thoughts and opinions from their own experiences. Please put those opinions and thoughts in the comments section. They always generate really interesting dialogue. As always, I hope you found this description of personality disorders to be interesting. Thanks for watching.